Y'all, I just wanted to take a quick second to come on here and talk a little bit about the hepatitis B vaccine controversy that is all over the interwebs, present some factual, evidence based data, and hopefully generate a useful discussion. For those of you that don't know me, I am Megan. I am a nurse practitioner and a busy OBED. I'm a former labor and delivery nurse, and it is always my goal to present all the information to my patients, let them ask questions, clarify anything they don't understand, and make them feel empowered to make the best decision for themselves and their family. Let's talk about hepatitis B. Hepatitis B is one of the most hardy viruses out there. It can live on seemingly clean surfaces for 7 days. 7. It is 100 times more contagious than HIV. So it is not only transmitted through sex and needle sharing. I'm going to give you an example. Say you have an aunt that comes over. Your aunt doesn't know that they have it. She has a cut on her mouth, may not be visible blood. She kisses your newborn baby. That is a risk for transmission. 50 to 60% of people in the US that have Hep B do not even know they have it. Another fact, since universal vaccination began in 1991, Hep B infections in children and teens have decreased 99%. Okay, so why do we vaccinate babies? Data shows that 90% of infants who are infected around birth to the first year of life will go on to develop chronic infection, cirrhosis, liver cancer, compared to only 5 to 10% of older children or adults who become infected. I totally think it's fine for patients who have good access to care and who follow up on their appointments and all of those things to get it at the 2-month appointment, talk to your physician about it, all of those things. This is where the problem lies. When ACIP makes recommendations and they are changed on the CDC vaccine schedule, insurance usually follows suit as far as coverage. I know they have come out and said that through 25 and through 26, they will continue to cover the hepatitis B vaccine at birth if the parent chooses that. However, if you know anything about insurance companies, they will try to find any way to not pay something. So my concern is, and other providers across the country, the concerns are that these high risk, underserved patients who they're our most captive audience when they're there in the hospital, they have trouble making their postpartum appointments, their PD appointments. Sometimes you don't see them again for a year. The best way to get our most underserved population vaccinated and protected, and they're the most at risk, is before they leave the hospital. If insurance stops covering that, it's just going to be detrimental for that population. So that is where it makes me sad that our underserved population could potentially be at an increased risk because of these changes.